Well, February is National Heart Month. And joining us this morning, we have Kelly Clark, a Marketing and Communications Specialist with Titusville Area Hospital, joining us. Good morning, Kelly. How are you? Good to see you this morning. February is National Heart Month.
It's National Heart Month, and it's a month that we, look at a lot of risks and a lot of different things during the month, bring up some awareness, major risks that involve women especially. We are going to have a Go Red day on the 4th, which is Friday, and we just want everyone to wear red at the hospital. We take a group picture, and it's really just to show awareness for the statistics that affect women. So 1 in 3 women will be have a death related to a heart disease or a stroke. So wow. It's just a really big number. So every year we try to, raise awareness for that.
It would be nice if you brought in somebody who could tell us more about heart issues.
I know.
Oh, you did. And this morning we welcome Dr. Wilson. Good morning. Good to see you.
Hello. Nice to see you again.
You've been on the program before. It's been a couple of years.
It's been a little while.
Yeah, it's great to see you.
3 years. Yeah, you too.
So tell us a little bit about Heart Month and kind of the stats that Kelly was getting into.
Yeah, this is always, because of obviously Valentine's Day, they picked this month for Heart Month. There's always been a push recently for looking at women and heart disease. Traditionally, women have been a little bit ignored. Women tend to get heart disease later in life. Once you reach menopause, you catch up very quickly to what men are within 3 to 5 years. It's the same risk, but women live longer. So you tend to have just as much heart disease in women. And it's still the #1 killer of men and women. When I say heart disease, it's cardiovascular, it's stroke, it's heart attacks, things like that. So this month is always for us to sort of reflect back on that because it's one of the most important healthcare issues that we have. Next to COVID, of course, which we can talk about a little bit too, as far as the heart goes. But it's an important time to reflect back and look at risk factors and really try to figure out how we can make a difference. Over time, things have gotten better. The COVID numbers are going to show that our life expectancy is down. But that's just because of the number of deaths, and who knows what the long-term effects are going to be. And again, I don't want to dwell too much on that, but the heart disease numbers have come down just because of aggressive care. But we all live till we're older, and so the risk is always there. So
are the signs pretty much the same for men and women, or are they different? I love this. All the studies that were done back in the day, which a lot of it was done through the VA system, all men, some men have typical symptoms. Women have atypical symptoms, but they're very typical for women. So men tend to have more what you would consider, the chest pain, the squeezing here. Women tend to have more fatigue, more shortness of breath. Women tend to ignore their symptoms because they're making dinner for, their husband while they're having their heart attack, and will wait to come in later. They present later in life, so there are a lot of differences, but they're very typical symptoms for women, and so you just have to kind of separate that out and say, this is you, and listen. And that's sort of it. Don't wait around. I mean, this is the quicker you can get medical attention, the better off.
It's as serious as a heart attack.
Yeah. Well, talk about that
true.
though. There's just if you're experiencing pain, don't wait. Get to the hospital.
Yeah, there's no crying wolf for the heart. At any one time in the hospital, probably half of the people or more that are in with chest pain don't have heart problems, but half of them do. I'm just putting a number out there, but you don't know who's who until you come in. You get some blood tests done over 6 to 8 hours, repeat EKG,
that sort of thing. But you never know. But there's no crying wolf at all for heart problems. You got to get there. If you're having the big one, 30% of people will be dead before they get to the hospital.
Oh.
So you can't wait.
You mentioned the COVID factor. How much of the last couple of years and just stress in people's lives contribute to pain in the chest, but that might not translate to heart attack necessarily, but just the stress?
So there's two things with that. One is that people have tended to ignore things because they didn't want to be in the hospital. They were afraid to be in the hospital because of all the COVID that was in the hospital. So that made a big difference, I think, in late presentations. We saw early on people presenting many hours or days later with heart attacks that they just ignored.
Wow.
Stress, there's something that can happen just with stress with the heart, and it is actually more predominant in women. They call it the broken heart syndrome, where you actually can stress the heart enough with adrenaline that comes from the brain on down that you can have severe dysfunction of the heart and arrhythmias and die from it. And it's I don't know why, when I came to Crawford County 9 years ago, I've seen much more of it here than I ever saw in Pittsburgh. I don't know why, but it's a very predominant thing, and we've seen a lot of it during the COVID times.
Yeah, that's incredible. I'm amazed at how much technology has changed in heart care. I know somebody who recently had like 4 stents put in and out that day.
Yeah. Some of that's COVID too.
Yeah.
We're trying to not keep people in the hospital if we don't need to, but the technology, we're 5-6 generations of stents, down the road. I was the first person putting stents in Western Pennsylvania back in 1994, and I've seen it all. And it's been incredible for us. Now it's just sort of standard. You can get stents almost anywhere. They're flexible, they're strong, they're long-lasting. So a lot of times we don't send people for bypass. We're limited a little bit at Meadville what we can do just because we don't have open heart surgery. So some of that stuff we send up north if it's complicated stuff, but it's all stuff I've done in the past. It's just not right to do it there. But most stuff we can do there, and any emergencies we do there.
Kelly, we kind of go back to the conversation, with this age of COVID right now, people holding off on getting the care they may need, right? You should be seeing your doctor, keep your appointments. Right. If you are having issues, don't be afraid, get in there so something more serious doesn't take place.
Yes, and our numbers are coming down. Don't be afraid to come to the emergency room and think you're going to wait 12 hours. It's not like that. You may wait, but if you have something serious going on, we will bring you in immediately. Anyone that presents to the emergency room is definitely going to have an evaluation done. They'll be all checked out and moved on. If they need to be admitted, they will definitely find a place for you. So definitely don't be afraid to come in. We have wonderful doctors waiting for you. So.
And this is an area where, people work hard, people play hard. Your heart's being worked. Who knows what you're eating around here? Whatever you find in the woods. You're shoveling snow. It's just, people are really pushing themselves quite a bit.
Diet, lifestyle, obviously, smoking, things like that will affect the heart. So, a lot of the things that he sees is preventable, with lifestyle. So getting into your doctor, getting some good education is definitely important.
Dr. Wilson, I've seen kids take, lunches to school. I've gone in with our kids before and sat down, and you look over and, this kid has a sandwich, and some kids pull out, I kid you not, I saw a kid pull out pop, cookies, and potato chips. Yeah. That was their lunch. Are you seeing heart issues popping up in younger folks, or is it still?
We still see a mix of it. When they did autopsy studies, unfortunately, in car accident victims and whatnot years ago, you started seeing these fatty streaks in the aorta, even in teenagers. So it starts early on, and our diet hasn't gotten any better for the most part. And lots of fast food, lots of people are afraid of taking the vaccine for COVID, but they'll go eat a McRib sandwich, and who knows what's in that. But it's just, you know what I'm saying.
Yes,
and that wasn't my quote. It was something I saw on the internet. But it's just kind of funny that we put stuff in our bodies that we have no idea what we're doing, and it's just fast, easy, tastes good. I always tell people, if it tastes good, spit it out. Not exactly, but that's a cardiologist speaking.
Well, no, I start out well. I get the lettuce going, and then I add a little bit of bacon and the croutons and the salad dressing, and that's where it gets out of hand. But and parents today, everything's we're in such a fast food society, right?
Yeah, we are, and it's because you have dual working parents, you have busy schedules, there's sports all year round now. You don't have summers off, so for kids it becomes just a routine to get stuff done and homework, and it's a lot of everything. It's just easier for everybody. I think one of the things I did want to say about COVID too was number one, that people need to seek medical care, like you said, but also with this, 3-4 less trips to the store a week. You're not walking, you're not doing things. So even though we're busy doing things, we see the weights going up. People are just gradually gaining weight, and it's just part of what it is. So people are trying to stay safe, but at the same time, it's taken a toll on their cardiovascular health. So,
and people were joking about that, the extra COVID pounds, but there's a serious
real
side to that.
Yep. I worry when somebody tells me they're losing weight during COVID, because I can't figure out why. They're not going to the Y. They're not exercising it. I mean, they may be exercising at home, but it makes you think of other health problems. But we've seen a lot of just mild weight gain, but it's just enough. And people complain about it, and they feel like they don't have any energy, and because a lot of people have had COVID and they have the chronic, feelings of COVID fatigue. So
that goes back to, again, people getting stressed or not feeling that sense of normalcy. So it's easy to get that comfort food, right? You're grabbing the bag of chips, you're sitting in front of the TV,
and you're ordering it online, picking it up at a Walmart or wherever you go, and you're not doing the same stuff you would have been doing. Hand picking stuff, I think, is a big thing too. So you feel like you're being safe, but you're not taking care of your body. So I totally agree with that.
You're watching the Morning Drill on Stream Television and on Armstrong's Neighborhood Channel, and listening to it on the Allegheny News Talk Sports Network. Heart Month.
Yes.
Kelly, what else is going on at the hospital this month?
Well, I would also like to say we at the hospital have a cardiac rehab. So like he was talking about, we're not going to the Y, we're not doing a lot of things moving our bodies. Our cardiac rehab is still fully functional face-to-face. You can come in. So if that is something that anyone has dropped off of or, kind of stayed back from, we're definitely still having cardiac rehab. I know I'm sure Dr. Wilson recommends a lot of patients to our program. If anyone out there has been in our program, I know that everybody loves Angie. She's our nurse there. She does a really great job. So if that's definitely a need, we're definitely here for you.
Are you seeing or hearing folks canceling appointments just out of concern, or they're trying to bump it down the road for another time?
I really think that we're starting to come on the other side of that. I think patients have waited and waited and waited, and now, a lot of health concerns, and I think maybe they're starting to see, that this is more safe. Taking care of myself is more safe than being locked away and not going anywhere and seeing my doctor. So I do think that we're starting to maybe turn a corner on that.
Dr. Wilson, does that complicate things when people do wait and those issues might become more serious?
Yeah, I think it does. Cardiac rehab has been shown to benefit people greatly. It's a little bit insurance driven and it's not forever. So you have a program you go through. We had to shut down our program initially when COVID started just because we didn't know what to do with it. We have a small area. This was at Meadville. I just referred 2 patients this week, to the Titusville program that had heart attacks and I strongly recommended that they just get started with it. We have patients that have bypass surgery that we send up to Erie that we recommended for. One of the ones I sent was actually a bypass patient now that I'm thinking of it. But the sooner you can do that, the sooner they get back into life and they feel better because it's monitored. They feel like they're safe, so you get to know what you're allowed to do and what not to do. And it's just good. It's just good. Now, if you have somebody that's used to exercising, has equipment, has stuff, you may shorten the course a little bit. You may not. They may not want to do that, but it's still monitored, and it's really, I think, the best way to go for patients. And now we have just what Kelly was saying is, I think patients are now not afraid to go there anymore. They were initially, just like coming to the hospital, but it's a really super program here and at Meadville, and just depends, geographically where you lie. So
you kind of brought this up, but any long-term effects with COVID that affect the heart, or are those studies still being underway?
There's a bunch of stuff out there, and it's actually, first of all, heart patients are more prone to have problems from COVID because the way the virus gets into the cell, it gets in through something called an ACE2 receptor. And people with heart disease have more ACE2 receptors, so you tend to get more virus into the cell causing damage and inflammation. So, and if you have hypertension, diabetes, obesity on top of that, you're at much higher risk. And then there's the issue, once it does do that, it can affect the myocardium, which is the muscle of the heart. And there's a higher risk of inflammation of the heart muscle. And they're finding that in kids too now, adolescents, and it's important for sports. It's important for if you have significant inflammation of the heart, you're not supposed to do competitive sports for 3 months until things settle down. So that's becoming a much more studied issue. And it's apparent now why it's not just because you have heart disease, why you have a higher chance of dying from COVID. It's because you have more viral burden into the cells.
So if you're a young athlete, what do you do to check yourself to be sure that it's going to be okay?
So you can do an EKG, you can do blood testing, you can do a sound wave test of the heart. The best thing is an MRI. Now, unfortunately, cardiac MRIs around here, you're left to going down to Pittsburgh or to UPMC up in Erie is where the cardiac MRIs are that look for it. They're very good at looking for it. I've sent some people up to Erie and found kids with, fortunately, they did have myocarditis, but fortunately, they didn't have a season. When we found it,
Yeah.
it was early on in this, and I think a lot of people just do blood testing and EKGs now, and MRI is a little tough to do on every kid that's had COVID that is an athlete because there's tons of people.
Absolutely.
So,
Kelly, real quick to wrap things up. What else is going on at the hospital? And I guess if you're somebody who think you might have something going on, how do you schedule that appointment to see Dr. Wilson?
Yes, you can definitely call the hospital, ask for the cardiac department, they will schedule you an appointment. It's part of our physician services, so the direct line is the 827-9770. And you can schedule with Dr. Wilson. He comes to the Titusville Hospital. He's there quite a bit, and he's also in Meadville, so getting in is not a problem. Just give us a call. A couple other things we have going on. Of course, our golf scramble is coming up in May. Not too early to sign up. I already have 3 teams signed up.
Nice.
So
Really?
people are excited.
Get people out and moving, right?
Yeah,
Moving.
which is great. We're excited about that. We also have a screening coming up. We have a new speech therapist with us, Brianne Lipke. She started up our speech screening. So if you have a kiddo that you're not sure, maybe they're having some developmental issues, give the office a call, the hospital a call, and you can get your kid signed up for a free speech screening.
So even golfing when I'm in a golf cart, at least I'm getting fresh air, and I spend a lot of time walking through the woods trying to track down my
That
ball,
if
so.
it was a rainy day, you have to stay on the cart path, so you at least get a little bit of work, right?
Yeah.
We by the way, we are there almost every Tuesday of the month, seeing patients in the clinic over there. So that's where I'm headed after this. But we have one of my partners or myself that are pretty much 4 weeks of the month.
Wow.
Four Tuesdays of the month. So we're always available. So
And again, they can find you in Meadville as well to get that appointment
we're there every
scheduled.
day. So
It's great to see you
yeah,
again.
you too. It
All
was
the-
wonderful.
All the best. Come back.
Yeah.
Not just February.
Be safe.
Be safe. Yeah, come back.
And get around.
That's right. Move. Kelly, great to see you.
Great to see you.
All right.
Yeah, thanks for having us.
Have a good heart month.
Yes.
Keep your heart safe and healthy.
Yes, moving.
Yeah. Even in the month of love, try to remember heart health, right?
Right.
Love your heart.
Well,
And then you can love your relationships longer that
you
way.
can do
Right.
all kinds of stuff that month.
All right. Hey, thank you very much.
Thanks, Luke.